Post-traumatic stress, or PTSD, is a psychiatric disorder that may occur after an individual has experienced a traumatic event. This may affect the individual's mental and physical well-being, as well as their social relationships. A soldier has come back from a tour where he saw active combat overseas. At a point, he was in a firefight with constant shooting coming from both sides, where he was lucky to make it out alive. After a year, he reunited with his family and all seemed well. After a while, his family and the people around start to notice changes in his behavior. His wife notices he has been having frequent nightmares that have been affecting his sleep. He no longer wants to go to his children's school events because he finds it difficult to be around the loud noises and bangs that may occur in the gymnasium. When people ask him about his time overseas and any stories he may have, he struggles to remember the details of some of the events that have transpired. He struggles to relax, and people have noticed that he tends to look around and scan the area, even when they are in a calm setting with no threat of danger. One day, while sitting on the couch in his house, he heard the neighbors landscaping using a chainsaw to cut branches from a tree. He jerked his head over to see and then lost himself. He became disoriented and found himself back in combat. He struggled to breathe, could not control his emotions. He struggled to be calm and started to cry, not knowing what was going on, and found himself impossible to be consoled. He and his family decided that he needed to seek help and try to combat what he was going through. There is no cure for PTSD, but it can be treated through therapy and medication. Eye movement desensitization and reprocessing, or EMDR, is the process of having a therapist guide a patient through the memory that is deemed traumatic, with the goal of reprocessing it differently where the patient is in more control. Group therapy has also been proven to be an effective way to help victims of PTSD. The act of sharing your experience with other trauma survivors in a relaxing setting The act of sharing your experience with other trauma survivors in a relaxing setting has proven to be very cathartic and helps the patient cope with their experience and their actions during or after the event.